It's a great pleasure being with you today, and it's been a long day, so I would say maybe the best use is 10 seconds of meditation before we get started. First of all, what I'd like to do is reflect on who Phil is, and then go into health and healthcare, which you've heard nothing about in the news in the last period of time, and you know nothing that the person of significance said it was complex. So we have a real challenge. And for those who just gave the thing on workplace design, see how I start the program. So that's not me. Who is Phil? Phil has sort of an eclectic, but there was a psychiatrist in the room, sort of a Michigan lifestyle. I started in the 60s and started in agriculture, then went into environmental engineering, medicine, and then moved into NIOSH, the National Institute of Occupational Safety and Health, and traveled throughout this country, a lot in the rural West, to see about toxics. From there, I moved into public health, and from there, moved on to work with all the stakeholders, whether it was on the labor side, when there was more than 50% in the labor movement, and today we're down at figures of 7% in the labor movement, in the private sector, 13% in the public sector, which challenges the meaning of NIOSH or OSHA today. How many of you have ever heard of OSHA in the last period of time? It's almost non-relevant as far as its initial mission. It's totally relevant as far as its purpose, but that wasn't done. And then over the years, I've had the opportunity of working as all stakeholders, whether it was labor, management, employers, technology, Netscape as their concierge doctor, all of the military organizations and whatever, General Dynamics and whatever. And in the same place, you could see that there was lacking collaboration and cooperation. In the political scene, I worked both in the national scene for Senator Tom Daschle, and California was part of the California legislature. So with that, we come to a basic issue. And this is not new. And in the spirit of this week, and in the spirit of the Declaration of Independence, let me put forth three words that might have some impact on each one of us. We the people. We the people as persons, we the people as consumers, and we the person as patients. And think about that as we go through this conversation. Where are we? And what are we going to deal with health? This is not a new quote. It's a well-torted quote. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And all of you have talked about the global perception of health. It's all of us together. And we don't have a society that's made this high premium. With this, we should enforce the idea of a culture of health, because that would have impact on all of us. We're not there. So when we look at this, to have a little bit of genuineness on this, I took a trip just to get to here. And I went from the Sierras in California over the last day, through Nevada, and on to Utah, and drove from Utah to here. And we saw the rural West. It's not the first trip, but you could see all the problems with the rural West. And when you look at the rural West, it represents 20% of our population, and it's not being served well. These are all the people who had hope for a change in administration. And they voted 70% for our current president. And they're not happy with what the results are when it comes to health care. There are three definitions of the rural West. There's the metropolitan, which is Denver, Boise, Spokane. There's the interconnected space, and then there's isolated space. And when you look at this, they're characterized by disparities due to geography, demographics, economics, and you can read the rest. And there is unhealthy behaviors that are unbelievable. I can't speak for this town in particular, and this may be one of the enlightened places in the rural West, but I can tell you other places are having significant problems. With this, and we're not going to go through each one, the people are poor on average. They're likely not to have as good health care. They're on food stamps. There are more motor vehicles here that cause death percentage-wise than any other place in the country. With this, the rate of alcoholism and opioid addiction is off the wall. Maybe not as much as Indiana, Ohio, West Virginia, and Kentucky. The suicide rate for men is very high and is growing rapidly for the women in this area. 20% of the people in this area lacking any form of mental health. And most of the times when we talk about health and healthcare, we talk about physical illnesses and we sort of ignore mental health. So we have a real gap there. State of Iowa now, there's almost no psychiatrists in the state of Iowa. So you cannot service the people adequately. Higher death rates from chronic obstructive pulmonary disease, higher rates from heart disease, and how they get treated is poorly. Then it even gets more significant. Only 10% of our physicians work in the rural West, even though they represent 20% of the population. And the same thing about specialists. They don't practice in this part of the country. So we have problems with transportation. To get from a place like Durango to a larger city could be 1 to 5 hours. So we have a significant problem in the rural West that is for real. And the question is, what can we do about to help them now in a collaborative way, whether it's a Republican state or a Democratic state, and how do we make it today? There are programs that show that something can be done. In Cuba and New Mexico, where I just visited, they had the whole issue of bringing community health workers into a health and wellness program, which is very impressive. When we go to the issue of healthcare, it gets even more bifurcated. So you have health, the bigger picture, social disparity and all what that means, and then how do you get health equity? And that's hard to define, almost like resilience. And as I'm here, I'm beginning to feel I've beaten out the taxidermists on resilience. I'm still here doing my thing of change after all these years, and you got to keep pushing on. Social reengineering manifested. How successful or not, open for question. But nevertheless, as you see, socioeconomic factors are the predominant and largest impact, but we spend most of our money on clinical interventions. So it's disease state. Even in the academic institution, they concentrate, and I'm not saying it's wrong, on the issues of stem therapy or immunotherapy or radiation intervention. What the things that count most, maybe, are your housing, your education, all the things, your toxics, your energy, and the like. So how do you get them to be brought into the equation? And these all go in what really matters to health. Genetics, healthcare, lifestyle, community conditions, and keep in mind, 40% of all the dollars spent in healthcare are spent in the last 90 days to 120 days of our lives. Think about what the return on the investment is when we don't put more into our children and where they're at, and we'll get to that. So, a tale of healthcare. It's the best of times, it's the worst of times. And I'm seeing both of it. I'm seeing incredible progress. Some of the technology, some of the health data is working, some of the apps. How many of you wear a Fitbit on your arm? Few of them. If I gave out all of you, 100 of them, let's say there are 100 people in the room today, how many would be wearing it a year later? Well, that's better than percentage. It's 10%. So if I gave you 100 free, 10% would be wearing it a year later. So with that, it's the worst of time. We do not integrate public health, personal health, population health, place, and political will into a common integrated system. So in essence, and I'm skipping some slides, but we'll get through it, we have a costly system. In 1900, healthcare represented how much of the gross domestic product? Anyone want to put a number out? 5%. Excellent, 4%. What's it going to be in 2 years? 21% or 20%. It's going up. Have we had better quality, better care, open for discussion? We have variation quality. What are we getting about evidence-based medicine? And do you actually even know who your physician is or your primary care, what they do? And do they take the time to ask about you? So being part of the New England Journal of Medicine a little bit, they came out with a diagnosis last week that if you go to a doctor, the first thing they're going to tell you, diagnosis, period. And then you're going to ask them, diagnosis, question mark. And answer for yourself, how many have asked all the questions that are inside you to try to answer them? Very few. So we have a challenge on communications and education, and then coordination. With that, we see that we're still dying from too much diabetes, too much cancer and the like. The system's not taking care of it, and we got to go a ways to go. With that, for those who are interested in more detail, you can see we're having unnecessary services, inefficient delivery system, excessive administration costs, prices that are too high, missed prevention opportunities, and fraud. There are billions and billions of dollars in Medicare fraud every year in this country and poorly monitored. With this, as we go forward, we're going to have to create I hate to use this, an evolutionary revolution or a revolutionary evolution in the system. We're going to have to go from a 20th century model, like my wife has talked about in energy, but we're going to have to bring it to health. If someone asks, what's the ground rule or what's the foundation for healthcare in this country, not like a rapid rail. Rapid rail goes 200 miles per hour. Healthcare in this country is running at best at 60 miles an hour. It's a slow, archaic system that's heavily dominated by payers and providers, including pharma and devices, and it's not controlled by the payer, the persons, the people, the patients, and the consumers. So if we're going to get empowerment I can't use my MD degree solely. I have to use my identity as a person in a democratic society to make it work. And we're going to have to answer all these issues: the aging population, quest for value over volume, consumerism. At some academic institutions, you're paid not for your research anymore. You're given a base pay, and you're incentivized by the amount of people you see in any given day. And some of the ophthalmologists are seeing up to 60 patients a day for revenue generation. So we got some issues, and we're going to have to look at the key drivers, the business model enablers, the technology enablers, and bring this together, and we're going to have open discussion. It's got to be better than what you're hearing out of Washington today. Forgot the right and what they're doing, the left, we can go on for hours about that debate. But let me just state, even though I do have a political preference and I've been engaged on one side, I would have thought that someone would have put up a fix-it bill now, just not say, what's the alternative bill? Because there are issues that Obamacare made a start, I was a part of that, and now there were flaws in it. And we could have addressed the flaws in an open way and communicated for discussion. So there's an area there we could do better. So key issues, and we're coming down the line, we're sort of on time, hopefully. We're going to transition our organizational focus and capabilities from volume to value, lowering costs while improving quality. $3.3 trillion, 20% of our gross domestic product is very expensive. We're twice any other nation in Western society, and our results are probably at best at the 50% compared to other countries. New approaches to care delivery and relationships, where you are, number one, as a person, consumer, and as a patient, not only seen as a patient. Stakeholder alignment across the board, leading and engaging stakeholders of all sorts, and you have a lot of the stakeholders here. As I said before, I think this is the critical list of Ps. Each one has to have its own space, but integrated with the other. And public health, from all you've talked about, has to be raised. You don't even hear about public health. And now just read who the new head of CDC is today. Anyone you know see her credentials? Look at them strongly. They are not a powerful set of credentials for today. On the other hand, the new Surgeon General is pretty good. So the appointments are coming in from all over the space. With this is sort of what we should do now, in my belief. We have to take care of children, make sure they're not overweight or obese. Medicare should be used for more prevention. And I'm not so sure, if I had to put a premise, there should be a defined Medicare for all, which is means tested, with a high priority on prevention. And also, let me put this out as an idea I have, is I think all people should be given tax credits for letting their parents or any disabled people reside in their home with them. So there's a purpose and a direction rather than getting you to a nursing home. How many of you want to die in a nursing home? We got 100% opinion on that nine. So that's good, we got a consensus. So with that, we have to make progress. Improving, we have to have lifelong physical, mental well-being in our younger children, create communities that foster health-promoting behaviors, broaden healthcare, promote health outside of the medical system. So we're there. So in essence, all of you in this room bring this to the table. Innovation, because there's a resource of innovation here. Leadership, it's got to come out more than just the physician, the leader, the hospital administrator, the leader. All of you have to find a way to take leadership. Trust and transparency, the data has to be pure and meaningful, incredible. Quality of care, we have to define what quality of care is. The value proposition, what are you getting for what you're paying, and making sure it's held accountable. Financial strength, not financial inefficiency and effectiveness, and then collaborative cooperation at all levels. I would say concentrate more at the local, village, state, and then maybe expect less from Washington, except for standardization, because each state is its own place, but then you have to make sure that your people representing you are sincerely representing you. So with that, Albert Einstein put it all together. Logic will get you from A to B, imagination takes you everywhere. So hopefully, collectively, we can push the issue, maybe start with pilot projects, make them work, get some credibility moving forward. And if many of you are from the rural West, you got a golden opportunity to take your passion into action today, and then call upon all the organizations you're resourcing so they can collaborate across with that. It's been great pleasure. I look forward to meeting with any of you, and let's go forward together. Take care.